Hi, Leanna Mosier, East to West Med Ed functional practitioner. I wanted to come to you with kind of a longer video today, so if you wanted to know all about ADHD, follow along. So ADHD, we see a lot of in our practice, new onset symptoms in adults, also a lot of parents concerned for their kiddos. So let's talk about ADHD. Obviously, it's attention deficit hyperactivity disorder. There's hyperactive type, inattentive type, or there's mixed type. So first we want to kind of look at the symptoms, and usually you'll be given testing in the form of maybe a Vanderbilt questionnaire. Adults will fill out kind of a self-report scale of 0 to 5. You know, how often are you missing part 2 of an assignment, having trouble with follow through, forgetting things, interrupting others, struggling to sit still. And there are also some forms for parents to fill out, for teachers to fill out when we're talking pediatrics. So first of all, there's the testing, right? There's doing an inventory of symptoms. And sometimes when there's a lot of other things going on, we need to just do a full order for neurobehavioral evaluation when there's concern for dyslexia or memory impairment issues, other developmental delays, autism spectrum symptoms, and things like that. But when we're talking about ADHD and we're having those symptoms and we're positive, then we want to kind of look for a root cause of that. So we do a lot of genetic tests around here, and a couple of them that can be more prevalent with ADHD symptoms is MTHFR, which I did a video on that earlier. There's also the COMT gene, and both of these have to do with methyl donor groups and being able to methylate certain B vitamins to make SAMe, to make neurotransmitters. The COMT gene specifically has more to do with being able to break down catecholamines that calm down over responsiveness, over excitability, and things like that. So we do like to look and see if there's any genetic precursors, so we know what gaps we need to fill in nutritionally with supplements or whatnot. And then we also want to do a really close inventory of birth history and exposures. Is there heavy metal exposure? Was there a really bad virus, mono? Was this following something? Was there mold in the home? Mycotoxin issues are more prevalent than one might think. And so we really want to make sure there's not, the need for a full detox as far as doing a heavy metal detox. I had one kid who was through the roof on lead, and they're not really sure where it came from because his home or his school was newer, but he was very high in lead, and we did a lot of work to detox him, and his symptoms really dramatically dissipated. And this kid was quite on the spectrum as well for autism. So a lot of symptoms cleared up pretty dramatically just by looking for the root cause. So there's that. And then when we have a diagnosis, we got to look at some treatment options. And I'm going to try to make this video short, but because it's a loaded question or a loaded subject for us in the office, it's really hard to make it short and sweet. But looking at different supplementation and diet, the first thing we would say is go gluten-free. Gluten converts to glutamic acid in the brain, which causes neuroexcitability of those transmitters, problems with sensory processing. Red dye number 40 is awful. Artificial sugars and sweeteners, they just, if you were to look at functional brain MRI imaging where the brain's lighting up, it's just a loss of fluidity when you have gluten involved and those chemicals involved in the brain. So it really slows down those sensory processing abilities of the brain. So diet is huge. Trying to eat clean, organic, avoid any additional chemicals on the body, right? Because if anything, we're trying to detox those. And then there's some key supplements. So the methylation supplements are huge, just with methylated B vitamins. So going on a methyl B complex or a good multivitamin with enough methylated Bs in it. When you look at a lot of things that happen in the body, it's often, especially with MTHFR and COMT, it's a methylated B vitamin powered by magnesium. So we want enough Bs and magnesium in the body at all times for lots of different things that happen. Beyond that, we also have zinc is very important for pre-liver detox, but also because zinc helps to push omegas, another supplement, into the brain synapses for use. So we have these neurons in the brain, and then we have these long synapses that are formed with a phospholipid bilayer of healthy fats and phospholipids. And that is kind of like putting oil on the Tin Man. It speeds up transmission of those nervous system signals and just transmission from neuron to neuron in the brain. So zinc helps push those phospholipids into the brain. But then we have an actual phospholipid called phosphatidylserine that is a remarkable supplement that's over the counter. 200 milligrams, ages 4 to 14, studies showed tremendous improvement in ADHD symptoms and focus and memory compared to the placebo group. So 200 milligrams daily of phosphatidylserine is huge. I've recommended that to patients just to help inhibit cortisol at night and help with staying asleep because it can do that too, but really great for ADHD and focus and enhanced performance. Another one is L-theanine. We also recommend that for anxiety too, but it really helps the brain to find calm and focus. They have dissolvable ones that are a couple hundred milligrams. You can do, before work, after work, before school, after school, when doing homework. It can also help prepare the mind for sleep without making you tired. Just really helps with focus. Some parents like to give their kids caffeine in the form of a cup of coffee. I would prefer some diluted green tea through the day if they need that extra little kick to get them through. But those are all just some natural measures, as well as avoiding blue light, electromagnetic fields, getting adequate sleep, and addressing any sleep issues, and things like that. So those are some natural supplements. Now, of course, there is a time and a place for pharmaceuticals, and we try to avoid those when we can and encourage doing some more functional testing and root cause testing to really make sure there's not something else we can treat to resolve symptoms or resolve them enough. But when there's a true ADHD and nothing else to be found, it will affect learning. It will affect memory of some concrete skills. So we do need to treat it. And there's a time and a place for medications, and we're here to coach through that as well. So anyway, I hope that this video really helps you with kind of figuring out where you can do a self-test and kind of do an inventory of symptoms on yourself or a friend or family member or child to see if it's something you need to talk to your provider about, and also some tools and tips for how to mitigate it, what tests you might want to ask for to try to get you through it. So anyway, if you want to hear more, please comment, and I hope this has been helpful for you. God bless.